Hi, my name is Nancy Rumore. I am the Director of Community and Outreach for Hunterdon Behavioral Health. And I've been asked to do a presentation on the services that Hunterdon Behavioral Health offers the community. And I have with me Angela Sufo, who is the coordinator of Intensive Family Support Services. We have quite an array of services at Hunterdon Behavioral Health, and I'll start with the services for adolescents. And we have an adolescent intensive outpatient program for ages 12 to 18. Lindsay Miskowitz is the coordinator of that program. And it's really to help adolescents who are in an acute situation. So that's one of our children's services, our adolescent services. We also have a school-based youth services program where we put counselors, master's level therapists into varying schools throughout the county. So we are in North Hunterdon, we are in Voorhees High School, we are in Hunterdon Central High School, and we are in a number of middle schools and elementary schools throughout the county. This is a county funded program, so it's free to any of the participants. And it's a supportive counseling program for the students. It's all done within the schools. And then we also have a summer program for our students that participate in our school-based programs. Moving on, we have intensive family support services, and I'm going to ask Angela to explain what that service is.
So, hello again, I'm Angela Chufo. I am the coordinator for Intensive Family Support Services at Hunterdon Medical Center. We are grant funded, so we offer a no-fee supportive counseling to family members who have loved ones 17 and a half and older who have mental illness as their primary diagnosis. Referrals come to us from a variety of places. It could be from the emergency room. So after they get screened from a screener, the referral might come from there. It could come from a self-referral. It could come from NAMI. It could come from our 2 Central, our voluntary unit. So they come from from an array of places. We do have a virtual support group that we hold the first Wednesday of every month. In the past, prior to COVID, we had held that in person. People really enjoy that. So we do try to maintain that. We also quarterly have a newsletter called Perspectives that we do, and we send out to Hunterdon County. And we also try as much as possible, but almost monthly, to have a psych ed presentation that we feel would appeal to our family members and to what may be going on at that time. For instance, September, October, it may be suicide prevention or something along those lines. So we do see people in person. We see people in our offices in the community. We can talk to them over the phone, which is mostly what we've been doing, but we are getting back out there. It depends on everyone's level of comfort. That's probably, that sums it up.
So the next programs are, we have our career services program that's called Pathways Employment Services. This is also a grant funded program. It's funded through the state Division of Mental Health and Addiction Services. And we provide career coaching to 18 years of age and older. We help people to try to figure out what they want to do. I always used to say it's very simple. We work with people on how to choose, get, keep, to choose the kind of work they want to do, how to get the kind of work, and most importantly, how to keep it. And, it's been a challenging time during the pandemic, but we actually have been very, very successful in helping people to achieve their career goals. And referrals can come, and this is the thing about all of our grant funded programs in particular, is referrals can come from anywhere. So for IFSS or for career services, it can come from a self-referrals to medical people referring to really anybody in the community. A parent can suggest it, a spouse can suggest it, but referrals can come from anywhere. And I think that that's key particularly for the grant funded programs. We have a self-help center that is also grant funded through the Division of Mental Health and Addiction Services. It's called the Getting Together Self-Help Center. Again, quite a challenging time during the pandemic, but they have kept their doors open, where they are providing just a place for people to go to. It is not a treatment program. And so people can come and go as they want. And that they are open on Mondays, Wednesdays, Fridays, and Saturdays. And they have modified hours right now, but hopefully we'll all be out of this pandemic and we'll be able to have some semblance of, I guess, that they call the new normal. I'm just looking at my list. Another program we have is called our Older Adult Counseling Program. This is a county funded program. And what that provides is in-home counseling for individuals 60 years of age and older. Now, this particular program, which is a little different than some of our other ones, and I have to backtrack a second, is that people who are involved in our older adult program, there is not a requirement of a mental health diagnosis. It's for people who are just experiencing some kind of what we call emotional distress. It could be loss of independence. It could be loss of support network or a spouse, or, their health issues. And so they provide the in-home counseling as well as linkages to outside services. The key to this program is that they trying to assist people to age in place. What can they do to help them to remain safe in their homes and age in their homes with dignity, and a quality of life. With the career services, just to kind of backtrack, there is a requirement based on the grant that the person have a mental health diagnosis for our career services. Along with that, we also have support groups for caregivers. So it's a little different than the one that Angela spoke about with intensive family support services. This is for caregivers of elderly people. We have a particular group that is for dementia and Alzheimer's, and some caregivers, and this is for informal caregivers. It's usually a loved one, a spouse, or a child being the caregiver for somebody in their family. It could be a neighbor. And so the groups are facilitated by the older adult staff, and they meet 4 times a month. We have 4 groups going 4 times a month. And they are, it really is just peer support for caregivers who are really going through very difficult times. And one of the groups is a component of, they do education. They'll do after caregiving. You know, they do a group called, oh, now it's escaping me. But you know, like people often when you have a significant illness like Alzheimer's, you are grieving before the person is gone. And so they have a group pretty much dedicated to that topic. So those are our caregiver groups that right now are being run virtually. Hopefully at some point they will be back in person. We have addiction services. They are our outpatient addiction services. They run an IOP in the evening. So we have dedicated staff that are, accredited to do addiction therapy. Our outpatient department is your traditional outpatient psychotherapy. It is, we have an access center that people call into. The access center pretty much is the hub. People call into the access center and they are directed to the service that would most, benefit them. If somebody is interested in seeing a psychiatrist, they would first go through the access center and see a psychotherapist, and then the referral to one of the psychiatrists or APNs. And then that segues into our Department of Psychiatry, where we have a number of psychiatrists, as well as APNs, advanced practice nurses, all of who can prescribe the medications. Let's see, what else? We have a voluntary inpatient unit. It used to be 14 beds, but I think they did some rearranging and it's reduced. I think it's to 12-bed inpatient unit. And that is, accessed through the screening center when somebody is screened in the emergency services. We are the screening center for Hunterdon County. And so anyone who is having a psychiatric difficulty in this county would generally come to our emergency room and be seen by one of our screeners in emergency services. And I would say that we have a video of the screening process that's on the website of the Hunterdon Medical Center and Hunterdon Behavioral Health's webpage. And that is a very important one because it really does help, like for people who maybe this is their first time having an issue, it could be very frightening. And the video really takes you through what happens when somebody enters into the emergency room with a psychiatric acute episode. So I would just make that recommendation. And it's also in Spanish. It's English and Spanish. We also have the voluntary inpatient unit, and then we have what we would normally be called like a step down, and that's our acute partial hospitalization program. It's meant for people who it's short term, and it's meant to assist somebody who is in an acute state who does not require overnight hospitalization to work with the therapist in group therapy over the course of either a full day or a half a day. And it's usually over about 4 to 5 weeks. And then last but not least, we do have our day hospital, which is a group therapy run program for individuals who, we have the short-term acute program, and then the day hospital would be for people who need a longer period of time to be in a structured treatment program. They all are functioning right now. They are not functioning at capacity due to the current pandemic climate that we're in, but they still are all functioning. So I don't know if, I hope I didn't leave any of our services out, but as you can see, they really do run the gamut of many different services and offers to the community. So if you have any questions, we'll take them.
Nancy, you had said pathway. Can you hear me?
Yes,
Is there an age
18.
limit or start age, where to start and where to end, or isn't there,
So by regulations with the grant, we we provide services to people over the age of 18.
Okay.
And we don't have any end age.
Okay. And the other thing I have, we all here know what IOP stands for, but if somebody's watching, they may not know.
Absolutely.
Can you explain what IOP stands for?
Sorry about that. Yes. It stands for Intensive Outpatient Program. So it's really an intensive psychotherapy program.
Nancy, hi. Thank you so much for that informative presentation. And I know that I get confused when I see all the different providers. So we have Easter Seals, we have Catholic Charity, we have, I'm trying to think of, is it Pathway? But anyway, and are those under your umbrella or are those separate? And how does one know which of those providers or services to go to?
Sure. Yeah, it's a good question because it can be confusing, but Easter Seals is separate, as is Catholic Charities, and probably the other one you're thinking of is Bridgeway.
Bridgeway, yes, thank you.
Yeah, right. So they are all separate from us. I think a lot of times when you see any of our programs advertised, you will see the heart. The Hunterdon heart is always a good symbol that lets you know that, but it can be confusing. There's two different partial care day hospital programs in the county. One is High Point, one is the hospitals. And there are a number of addiction services in the county, as well as outpatient programs. So it can be confusing. It's just this being able to drill down and see which program is where.
So is it a matter of location, jurisdiction, that one area is covered, another area isn't? Is it a matter of insurance paying for something and not paying for something else?
Not really. To answer your question, some of our grant funded programs, we are the only program in Hunterdon County. So the intensive family support services, the older adult program, the self-help center, or our career services, we are because we're funded through the county or the state, we're the only program that provides those services. But the others, all it really could be a preference. for some, it's a preference, you know, oh, I'd rather go here than go there. For others, it absolutely could be insurance. You know, the insurance providers, or if they have Medicaid, who would be the provider for that. So it does often play into the question of where to go for services.
Nancy, thanks very much for running the summaries on all the programs. If an individual wants to access anyone in particular, is there a central resource or a list of numbers? How do we let the people connect with these programs?
So the Access Center is the hub, as I was saying, and they could definitely find out information about the programs through the Access Center. On the Hunterdon Medical Center website, there are links to all of our behavioral health programs. So there's a description of each program there, and the main number for all of our services would be the 908-788-6401 number, would be the main number for behavioral health.
Is there a website as well?
It's on the hunterdonhealthcare.org website. Yes.
Nancy, one more question from the peanut gallery.
Actually, I have a question for Angela.
Yes.
Angela, is your partner that you worked with for, I forget her name, is she
Cherie?
still with you? Was it?
Cherie?
Yes, is she still
Yes.
with you?
Yes.
Okay, good. I have to say that you guys, you know, make a good pair. You really, and I'm not just patting you on the back, I mean it. I have recommended people to you. And, you know, I've gotten responses back from them that they were very, very happy with, you know, the service that you provided for them. So I just wanted to throw that out to you.